Childbirth is a natural, normal, and healthy experience that can be very satisfying for women and their partners. Use of the Rebozo can help. Help a pregnant woman with round ligament pain by applying very light pressure to her lower abdomen with the shawl, while providing emotional support and helping her to relax as you both move from side to side. Help her to relax with soft touch. The Rebozo provides a wonderful feeling when sliding the shawl along the body from head to toe to stimulate the skin. Move the Rebozo over the mother using a shaking motion. Invite her to imagine tension lifting from her body and encourage her to relax. Aromatherapy can be included if you scent the Rebozo with a smell the mother finds familiar and appealing. This can help her into a deeper state of relaxation. After you cover the mother with the Rebozo, she may desire to stay in this position and rest while enjoying the scented Rebozo, as you provide her a comforting and light massage. Sometimes tension builds in the neck, shoulders, and upper back. Either during pregnancy or in early labor, the Rebozo, as demonstrated here, is one way to help the mother to release tension using a combination of passive movement and slow breathing. Invite her to relax into the movement and to let go of tense feelings. The Rebozo can also be used as a tool to help women to focus. By carefully covering her eyes and ears, we help minimize distractions so the mother can get in touch with her instincts and her inner strength. Light pressure around the head with the Rebozo, in combination with the stimulation of pressure points, as shown here, releases tension and decreases headache. Invite her to focus on herself and to visualize a healthy and positive delivery experience. Separation of the pelvic bones during labor often creates discomfort. While in labor, most women desire counterpressure during or between contractions. Use of the Rebozo to embrace the whole hip area and apply pressure in compliance with each woman's level of comfort. The knee press technique is most effective if you pull the woman's hips towards you with the Rebozo and press her knees with your own body. Women with back labor pain may find hot or cold compresses effective in decreasing pain. The Rebozo can hold either an ice pack or heating pad in the right position while the mother moves with her birth companion. Slow, fluid movement or dancing helps to induce and speed up labor through more regular and efficient contractions. Physical contact with her partner also gives the laboring woman reassuring feelings of comfort and support. When the abdomen is lowered, discomfort may be felt in the pelvic area. This can be relieved when the birth partner supports the woman's abdomen as they both move from side to side. Love and trust are powerful emotions that help women feel secure and confident when giving birth. When a baby enters the pelvis in a posterior position, labor can be longer and more painful. We must help the baby rotate into a more adequate position. The doula can apply a stroking motion in any given position the woman adopts by pulling the Rebozo several times in the direction the baby should rotate. Traditional midwives in Mexico have used the manteada technique for centuries to shift an incorrectly positioned baby. Before labor, you can help a woman to relax and then pull the Rebozo to the side the baby should rotate. Make sure you gently move the woman's body from side to side. Since one of the favorite positions to help rotate a posterior baby during labor is with the woman on her hands and knees, you can do the abdominal stroke with the rebozo in this position. First, help the woman to relax. Then pull to the side you want the baby to rotate. Be gentle and ask the woman to let you know how she feels. Between contractions, she should rock her pelvis to help the baby rotate and continue to move through the birth canal. If you need a laboring woman to remain in a mid-chest position for some time during labor to help the baby reposition itself, gently support her abdomen with the rebozo to her level of comfort. This is a movement that helps the baby's head to align with the birth canal. Gently lift the mother's abdomen with the help of the rebozo between contractions, as you ask her to tilt her pelvis and slightly bend her knees several times. When women are not used to sitting on a birth ball, they're often afraid of falling. The rebozo gives them something to hold on to and a greater sense of security as they move on the ball. To relieve back labor pain, women can press their back and hips against a birth ball. They move from side to side for self-massage and counter pressure. The birth ball can be held either by the partner or against the wall. Pushing efforts are more effective if the mother can hold on to something. By pulling on the rebozo, she feels a sense of power and can focus and relax her pelvic floor. She pulls and releases the rebozo in coordination with her urges to push her baby down through the birth canal. The birth companion sits on the birth ball for support as the woman pushes in a squatting position. Her upper arms rest on her partner's legs. The woman can grab the rebozo held by the doula. When the contraction is over, she gets on her hands and knees, rests, and receives a comforting massage until the next contraction. Then she gets back into the squatting position. The straddle position can also be used to push a baby out more efficiently. The woman kneels and grabs the rebozo while she pushes. Her legs and knees should be positioned in such a way that she is able to adjust her weight between her hips. This position is widely used by experienced indigenous women. Lap squatting offers another option for pushing. In this position, the whole hip area is pressed by the rebozo. The rebozo is securely held by the doula. The woman focuses on relaxing her pelvic floor. When the contraction is over, comforting words from her partner are all she needs to keep working. The rebozo is used to provide support to the birthing mother as she squats. The birth partner firmly holds the shawl above the woman so she feels resistance as she squats and pushes. The advantages of movement during labor and delivery are widely recognized by those healthcare providers who support normal childbirth and believe in women's instincts and inner strength. The rebozo has been used by traditional Mexican midwives for centuries and offers another option to help women deal with discomfort and pain in combination with other well-known devices, such as the birth ball. hope this demonstration will give you some new ideas to work with as you help women to have their babies in more natural, healthy, and satisfying ways.